I'm happy to report that there are now 5,205 Albertans who have recovered from COVID-19, leaving 1,131 active cases in the province. Currently, 65 people are hospitalized, with 10 of those admitted to ICUs. We have confirmed 50 new cases out of 4,816 new test results completed over the past 24 hours. Sadly, I must also report one additional death of an individual in a Calgary continuing care facility. This brings the total number of COVID-related deaths in the province to 121. My sympathies go out to all those who have lost loved ones during this time. There are 100 active cases from outbreaks in continuing care facilities and 569 residents who have now fully recovered. We continue to monitor all of our outbreaks very closely, working with the operators to contain the spread and making sure that all public health measures are being taken seriously. Many Albertans have questions or may be unclear about what Stage 1 of Alberta's relaunch strategy means for them. I've also heard concerns from Calgarians and residents of Brooks who are feeling that it is unfair that we are taking a more gradual approach to relaunch in their communities. I want to reinforce that the recommendations I have made are never taken lightly. Since last week, we have been focusing our planning on a balance of protecting the health of Albertans from COVID-19 and the health of Albertans from the impacts of a prolonged shutdown. If we move too far in either direction, neglecting the other, our outcomes will be worse. Our best path is in seeking that balance and making adjustments along the way. In communities outside of Calgary and Brooks, coffee shops and restaurants are able to open at 50% capacity, while others, including those in Calgary and Brooks, are choosing to continue to offer pick-up or take-out options. Hair salons and barbers are taking appointments or preparing to welcome customers. For Brooks and Calgary, these businesses will be able to resume on May 25th. I understand having to wait the extra 10 days is frustrating for residents of these communities. The reason for this 10-day wait is to allow us to monitor any increase in spread caused by the opening of retail, daycares, and other activities in these communities where there is a higher baseline rate. Although a full incubation period for COVID is 14 days, in other jurisdictions where reopening has started, it has been possible to see a rapid rise within 7 days where there have been problems. This relaunch will require patience from all of us and continued practice of public health measures so we can continue with our relaunch plans as quickly as possible. Finally, the 15-person rule that we have been following for months continues to apply to any gathering where people are coming together for a common purpose, where there is no single person or organization who is accountable for ensuring that public health measures are implemented. Social gatherings with 15 people or less can take place as long as those attending remain physically distant and the attendees are not sharing food or drink. The challenge is understanding exactly what has been driving the numbers, and I think I've mentioned before, we know that the early numbers in Calgary were higher than the rest of the province, likely because there are more people who travel internationally in Calgary than in the rest of the province. I think that part of the challenge we've had in Calgary as we've been trying to pin down cases has partly been the fact that, one of the possibilities is that with some of the early travel introductions, we didn't necessarily know about places in the U.S. that had cases. And so I do wonder, this is a theory and I'm not sure that we'll ever know for sure, but if we did have introductions in Calgary early on that were relatively mild and perhaps caused some spread that wasn't detected, that we're still having a hard time pinning down. So there's lots of theories and possibilities. What I would say is that in Calgary, we have seen relative stability or kind of a flattening of numbers. We haven't seen that declining as much as I think we would all like to see, but we also haven't been seeing a steep increase in the last few days. So I would say that Calgarians are working hard already, and that collectively, again, by making sure that we're all supporting each other, that if someone is feeling sick, that they stay home, they get tested, and that contact tracing can happen, that the possibility for Calgary to be catching up with the rest of the province in terms of having lower numbers, I think that's very doable. So I guess I would like to encourage Calgarians to see the relative stability as an encouraging sign and to work hard to get that to trend down, but in a supportive way. I really want to encourage not just Calgarians, but all Albertans, wherever we are, to be thinking about how can we be kind and compassionate and support anyone who does need to be isolating, anyone who's feeling sick. How do we make sure they have all the supports they need to do that? Because I think that we'll be in trouble if we take an approach that is punitive and makes, whether it's people in Calgary or elsewhere, feel like they need to hide their illness or that they're ashamed, because then it will be even harder to get a handle on it. So that I guess I would hope that Calgarians can feel like this is doable, and if anyone can do it, Calgarians can do it.